This video is largely inspired by a viewer I met recently who shared his personal story in China.
慢慢的，不要，慢慢的，你记着，我要剪，你记着，怎么样？记着，慢慢的，好的，慢慢往过翻，慢慢的啊。
This video was filmed in Xi'an, in central China. A man, a migrant worker, collapsed on the street. He had coronary heart disease and high blood pressure. When people rushed to help him, he didn't ask for an ambulance. He gave them a phone number, his family's number. He couldn't go to the hospital.
要让你这个月里面没钱，我又找不到工作，让您都来过了，我心绞痛，心正缺血。
A man in the crowd handed him 300 yuan, enough for a bus ticket home. There's a saying amongst Chinese people: small health problems are delayed until they become big health problems, and big health problems are delayed until you die. Here, a man in Xi'an, the same city, says his father worked at a dairy plant for 27 years, but he received no social security coverage and only gets around 2,000 yuan, a little bit more than that a month. He passed away on March 28th from a sudden collapse while on the job, and the dairy plant says they will pay some compensation, but that's it. The question is, what got him to the point of working and suddenly collapse, and why did the man with the heart disease have to go out and seek work without being treated first? In October 2013, Chinese state news Xinhua Agency published a story that briefly shocked China, and then it was quietly forgotten. A farmer named Zheng Yanliang from a city just south of Beijing had been diagnosed with severe vascular blockage in both legs. The infection was spreading. Doctors had told him clearly that amputation was needed and immediately must be done. Or, of course, it will reach his organs and it will kill them. Before treatment could begin, the hospital required a deposit of 300,000 yuan. That's roughly 40,000 USD. Not the total cost, just the upfront deposit. Now, for most rural Chinese families, that number doesn't exist. There is no savings account, no credit line, no insurance payout fast enough. So Zheng Yanliang did what many rural Chinese do when the cost of treatment becomes impossible. He went home, and the infection continued spreading. One day, he sent his wife out of the house, and then he gathered what he had: a hacksaw, a small knife, and a back scratcher wrapped in a towel, something to bite down on. Now, you might be thinking, where are you going with this story? Well, without anesthesia, without sterilization, without anybody in the room, he began the grueling procedure. The process took 20 minutes. He broke one saw blade. He cracked 4 teeth biting down on that towel. And when it was all over, he had amputated his own right leg. Now, the infection stopped spreading and he survived. The hacksaw story of Zheng Yanliang is not an anomaly. It's simply a data point, one of hundreds of millions in China. Meet Frank Zhao from Canada. He grew up in Lingyi, Shandong province. And in China, he worked as a pharmacist, worked as a former Novartis sales manager, a medical device industry veteran, and somebody who understood China's healthcare system from inside. But long before any of this, he was a child watching his mother get sick.
我记事开始呢，我妈就病倒了，她得的是慢性支气管炎，发作时就是憋气、呼吸困难、缺氧。那时候卫生室呢还是个人承包的，打的针呢基本上是抗生素、青霉素。你说这些药，你要说是有没有效果呢？也不好说。那至少有这个心理安慰作用哈。有时候出现就是昏倒在路边的情况了，突然就昏倒了。乡亲们帮忙把我妈抬上拖拉机。那时候村里最快的交通工具就是拖拉机。
对。
然后呢，就是拉到镇上医院去抢救。
When the township clinic could no longer treat her, the conditions had worsened, she needed a county-level hospital. County hospitals cost real money. Frank's father borrowed from relatives, from neighbors. Back in the day, people who had almost nothing themselves would even contribute. Sometimes people Frank's family barely knew would come to their door and hand them 10, 20 yuan. Not a lot, but that's enough at least to show that there was care. But Frank says that when he grew up, he and her sister never bought new clothes. Most of the money went to treatments for his mother. Everything was secondhand. And his sister even had to drop out of school at the age of 16 to work in a factory. And she later helped to pay for his university education. Now, that's the reality of many families in China. But the point is, the illness, what it does to a family, it takes everything. Now, here's the reality of healthcare in China. The system's spending as a percentage of GDP is actually not low. In 2023, data came in at approximately 7.1% of GDP. That's over 9 trillion yuan in total, or around 1.3 trillion USD. That's a real amount of money. Now, similar countries that have about 7 to 8% spending on healthcare are countries like Israel, Poland, and Czech. And all three of them have healthcare that is either universal or near universal. The problem is that number alone doesn't really paint the story well, because the problem is not the size of the number, the problem is where the money goes and who it actually reaches or who doesn't. In 2006, then Deputy Minister of Health Yin Da-chui made a remarkably candid admission to the public. China's 8.5 million senior officials, he said, were consuming approximately 80% of the country's total healthcare expenditure. Literally let that sink in, okay? Not seniors, senior officials. Okay, yeah, they were seniors too, probably, because, remember Xi Jinping told Putin about living till 150, right? The leadership longevity program. It's real. So 8.5 million people in China, CCP elite officials, 80% of the resources are spent on them, leaving the remaining 20% for over 1 billion people. That scenario doesn't exist in Poland, which spends about 7% too. Do they have a special class that sucks up 80% of the resource? Of course not. Does it happen in Israel with a similar percentage? Do they have a special class treatment? Nope. And that 8.5 million figure is from 2006. So it likely, or certainly I would think, has grown since 2006, 20 years ago. So for senior Communist Party officials, healthcare is not a concern, it's a guarantee. There's something in China that's even called a high cadre wards, which are basically, in Chinese it's called gaogan wards in the hospital. There's a particular section of elite hospitals reserved for officials, and depending on the rank, they have the country's best specialists on a 24-hour standby, the latest equipment, the best foreign imported drugs. Some things that even ordinary patients wouldn't have access to or cannot afford. Organ transplant services whenever they need it, available instantly at a remarkably unrealistic speed. But of course, that's especially for them. So what most people in China have is the system that they use or are familiar with, where you arrive early, you wait, you pay before you get seen, and in most cases, if you need emergency treatment and can't pay upfront, that's not going to happen. The treatment will not begin. China does have health insurance for all, on paper, okay? But there's a huge caveat, which is it depends on where you live, and it depends on the small area, whether that's a township, county, or the city. So there's no provincial, there's no states, but there's no provincial-wide healthcare systems. Now, for the urban workers in cities, if you work for a great company, that's very much going to be dependent on who your employer is. It's very similar to the rest of the world, where if you work for a big corporation, you probably have a good healthcare program going. But if you are in the rural countryside, or if you don't have a good job, well, the problem is very different. Since 2003, there's been something called a rural resident, it's called New Rural Cooperative Medical Scheme, that's supposedly going to solve the issue of rural residents in China without healthcare coverage. Back then, people paid out of pocket something like 30 to 40 yuan, which is a few dollars. Nowadays, they have to pay up to 600 yuan, which turns out to be around 100 something dollars. Now, for somebody that's a farmer or a low-wage worker making 2,000 yuan a month, 600, a quarter, more than a quarter of their salary per month, is not something they can afford. Now, in 2020, we also know that Premier Li Keqiang acknowledged that approximately 600 million Chinese citizens earn less than 1,000 yuan per month. A separate 2021 report found that nearly 964 million people earn less than 2,000 yuan per month. If we are to believe those numbers from the mouth of CCP officials, then that means their healthcare coverage could be as much as more than half of what they make every single month. And again, another one, if we're to believe that China's population sits around 1.4 billion people, which likely it does not, that leaves hundreds of millions navigating a system that does not function when it matters the most. Now you might be asking, wait, David, I thought that rural residents had insurance, right? You just said it. Well, like I mentioned, they do on paper. But when serious illness hits, the coverage begins to fall apart. Deductibles are high. Reimbursement is very slow, and in most cases, they're not done automatically. You have to reimburse on your own. And they're very bureaucratic because if you go outside of just that area where you live, they might not provide coverage. Very different from how you understand health coverage in the US would work, right? If you live in New York, you want to go get treated in California, they might not cover you 100%, but they might still cover you out of network. Or if you get a referral that's for medically necessary procedures that's only available in another state, well, then in those special cases, your insurance will likely cover it as well. Now, there's some exceptions, obviously, I understand that. But as I mentioned, if there's only one place where you get treated, you must get treated there. And even if it means that it doesn't work in China, well, the coverage can run out entirely if you decide to go somewhere else. So out-of-pocket cost is very high in China. Now, rural insurance is I would say, almost non-existent because the drugs that they give you or that's covered is not good enough. It might be a domestic brand. The treatments that you could get might be the slowest or at least effective one. And so if you want to start somewhere that's good because your condition is really bad, well, you better pay out of pocket. So when people become self-paying, that's when the destruction happens.
我妈终于由小病拖成了大病，直到不可逆转。所以大夫说你也没有医保。新农合在省城 我当时给县医院打电话，让他帮我开个证明，他也不给我开。他们认为是你妈这种病在县医院是可以治的，他不给我开，他不给我开会导致就是我是自费过来住院嘛。住了2个多月，一共花了12万多吧，12万多。
For a family that had spent decades borrowing 10 to 20 yuan at a time, this is a sky high number. This is where people make a bad comparison, right? They say that in the US, you could go bankrupt paying for your medical insurance. Again, in the cases that you are low income, you have Medicaid. In the case that you have an employer that can pay really good health insurance, you won't likely pay for much. Now, if you're stuck where you're paying private insurance and whatnot, there's still many ways like charity care, negotiating with a hospital, split payments, or you could do monthly payments, or you can even try to negotiate for a certain percentage of discounts. It is expensive, I'm not going to deny that. But if you get a bigger bill, the bottom line is you were treated. But in China, if you go outside your region without approval, your coverage not only can drop to zero, but the treatment may not even start. So one system charges you more and the other one simply shuts you out entirely. Now, if we are to believe the CCP propaganda saying that they treat people really well in China, well, then the lack of welfare coverage for the bottom class, so to speak, should exist, but it does not exist in China. Another point which I think is hilarious because China's hospital system is actually entirely self-financed in the sense that they operate based on revenue primarily from drug sales and medical consumables. Things like, you sell the more expensive drugs, you get more kickbacks, and that creates the structural incentive to prescribe more, order more tests. Maybe instead of an ultrasound, you get a CT scan, something like that. Keep the patient spending and they make more money. So the problem with hospitals in China is that while they are for profit in the sense that they want to make more money, their political structure is still maintained within the Communist Party system. So the head of the hospitals listen to the provincial leadership or listen to the municipal leadership, and that's where things get really tricky because the hospital government joint system or this business system is what largely incentivized forced organ harvesting in China, if you really think about it, right? The government, initially the primary victim group of forced organ harvesting were Falun Gong practitioners, who the CCP wanted to eradicate and destroy. So the hospitals wanted to make money, and the way they can do so is work together, use the organs to create a profit point for those people that want to have transplant surgeries, and that's why hospitals across China could participate and perform many transplants per day in order to have high profit. Here's another more recent story which shook the entire country. In May of 2024, a 28-year-old medical graduate named Luo Shuaiyu, working at Shangyang Second Hospital in Changsha City, mysteriously fell from a building, and this was just a month before graduation. Authorities ruled it was suicide, and his family disagrees. They say that Luo had been collecting evidence, documents, recordings, internal material, alleging serious corruption inside the hospital, including irregular financial practices, possible misconducts, organ transplant procedures that were foul. According to his father, hospital representatives later approached the family and offered 50 million yuan to stay silent. That's around 2 million USD. They, of course, refused because what followed raised more questions. Things like his personal devices, a large amount of the data was deleted. From the data that was recovered, there were recordings, materials, photos, videos showing what was happening in the hospital. Now, the hospital tried to shut them up by providing financial compensation, but it was under the condition that they had to officially conclude the case around the son. And the key evidence that we know that were made public from the father and the mother were things like that basically indicates that this hospital was performing something really bad and corruption was beyond we know. And there were recordings. In one of them, a staff member allegedly instructs Luo to collect organ samples from children, young children, and to extract blood in a way that, according to medical experts, would only make sense if the donors were still alive. Okay, let's be fair though. Again, healthcare systems across the world, especially in wealthy countries, they're not perfect. American healthcare obviously costs very high. Waiting time in Canada and the UK could be very long. And even in places like Germany or France or other Nordic countries, there's still problems, right? No healthcare system is perfect. But there is a structural difference. In most of these systems, the baseline is, or the assumption is, if you're dying, you're going to get treated, and billing is a separate problem. There's buffer between the medical side and the financial side of things. But in China, for much of the population, those buffers are either absent or don't function when it actually matters. So the result is very simple. People avoid treatment until it's too late. Small problems become big problems. Big problems become death. But the question is always, why? China has the money. China has the infrastructure. Taiwan, across the Taiwan Strait, achieved universal coverage in 1995 at a similar income level. According to Professor Li Ling, an industry-leading expert in China, she estimated that 800 billion yuan could have achieved universal coverage early on. But today, the total healthcare spending in China exceeds 9 trillion. The people who control the system are also the ones who benefit from it the most in China. And so senior officials receive elite care regardless of public system. They have no incentive to reform it then. Any redistribution certainly threatens powerful interests. But that's, again, it's not because they don't want to, it's because the system is designed to work that way. That's how the CCP, that's how communist parties work, right? The elites, the small groups, they're supposed to be fighting for the people en masse, are simply the ones who benefit the most. Now, in March 2018, Frank's mother died. She was 61 years old. She spent her final 11 days in the ICU surrounded by tubes. Frank said that he didn't cry at the funeral, but rather it was anger and frustration.
我甚至流不出眼泪来，是因为就愤懑的心情啊，压倒了一切。就是我妈跟病痛所斗争的这几十年，也没有说政府啊，或者是有关部门过来帮我们一下，全靠我们个人死扛。
Thank you very much for watching this episode. Let me know your thoughts in the comments about the system that I described in China when it comes to healthcare, or if you have any personal stories to share, or if you want to argue how your version of healthcare works, whether that's better or worse, let me know your thoughts in the comments. And thank you very much for watching. We'll see you next time.